University. We had a beautiful luncheon this morning, and then we all rushed over here because we really want to keep the celebration going. And so we have this wonderful panel event that it's been in long time planning, but we wanted to make sure we created an opportunity to really invite our students as well, right? Because we want them to hear from the latest and greatest leaders in Central Ohio, which we have up here, and we will have them introduce themselves in a moment. But just wanted you to have this wonderful experience to celebrate 75 years of nursing here at Capital University. Is just such a momentous event, and we're just so pleased that you're all here to share this special time with us. We also have another special welcome, so I will turn the mic over to President Tice, who would just like to do a brief welcome to everyone here.
Thank you, Dean. It is amazing to be with you all this afternoon as we celebrate homecoming, and we kicked off homecoming with celebrating our 75th anniversary of our School of Nursing. And I know I delivered to many of you formal remarks earlier today, but I want to shout out someone in particular. Dean, thank you so much for making this event possible with your wonderful gifts and contributions, not only to the school, but also to make this panelist activity take place. It is that type of rooted and open behavior and the philanthropy of alumni and supporters like you and donors like you that make things like this happen for Capital University. So I'm grateful for your great work. Thank you. And to our panelists, thank you so much for your contribution to wisdom and continuing to improve our practice. And today we're talking about the practice of being a nurse in 2025, and grateful for your leadership, your guidance, and your wisdom. So our nurses, our students go out into the world prepared to meet all the challenges. So thank you all. Enjoy a great panel discussion and continue to take in all that Capital has to offer today and throughout the weekend. So thank you all.
Welcome, everyone. Before we get started, I'm going to go ahead and read some disclosure information for this. This is a CE event worth 1.5 continuing education credits, so please bear with me here for a moment. This event is called Rooted in Purpose, Connected by Care, Leading the Future of Nursing. And the learning outcomes are that 90% of you will identify at least one strategy for integrating the philosophy of holism into your leadership. And 90% of you will describe one way that holistic leadership and compassionate care will shape the future of nursing. Also, the criteria for successful completion is that you will miss no more than 10 minutes of this activity. And please be sure to submit the evaluation form at the end before you leave. And please print your name at the top of it so that we are able to get that certificate to you. Finally, one last thing. This nursing continuing professional development activity was approved by the American Holistic Nurses Association, an accredited approver of the American Nurses Credentialing Centers Commission on Accreditation. Approval for contact hours through the American Holistic Nurses Association is based on the assessment of educational merit of this program and does not constitute endorsement or the use of any specific modality in the care of clients. So thank you for that part. Okay, thank you, President Tice. Thank you, Dr. Goodin. My name is Jaime Stevens, and I'm a faculty member here in the School of Nursing, also a part of the subcommittee who helped put this event together. Thank you all for being here as we continue our celebration of the 75th anniversary of Capital School of Nursing. Before we begin, I would like to take a moment to recognize some special people. First, I would like to recognize Dr. Doris Edwards, whose generosity made today's event possible. Doris, would you please stand for a moment? I'm going to say just a few words about Dr. Edwards. Dr. Edwards is truly part of the heartbeat of Capital University's School of Nursing. During her time as dean, she led with vision and heart, expanding programs, creating international partnerships, and building a foundation that continues to shape our students and faculty today. She has always believed that nursing is more than a profession, it's a calling to serve others. Her leadership reached far beyond Capital. She served on the Ohio Board of Nursing, chaired major healthcare boards, and was honored as a pioneer in nursing and a local legend for her lifelong contributions to the field. Dr. Edwards, your influence continues to ripple through every classroom, every nurse leader, and every graduate who carries forward the legacy you helped build. On behalf of us all, thank you for your vision, generosity, and incredible example for your example for being a leader, your strength and compassion. Thank you. I'd also like to recognize my fellow subcommittee members, and if you could just please stand, Tracy Hogue, Sharon Stout-Schaefer, Ashley Waltermeyer, and David Shields. Thank you for all of your efforts as you helped me organize this event. I appreciate all of you. I'd also like to thank Stephanie Van Tilburg and Sarah Said. So if they could please stand if they are here. Yeah, thanks. In the back. Both Stephanie and Sarah completed numerous tasks in preparation for today's events. So thank you for being patient with me and for being so responsive to all of my questions. Today's conversation is all about leadership, and at Capital, leadership takes many forms. One of the things that makes our program special is the legacy of our graduates, nurses who lead with purpose, integrity, and compassion across countless settings. Their transitions into leadership roles, whether at the bedside, in academia, administration, or community health, reflect the strength of education and the values rooted right here at Capital University. Today, we are so pleased to have 4 accomplished nurse leaders with us from across the Central Ohio area to give their perspectives on leadership and also our profession as it evolves through a rapidly changing healthcare landscape. Marti Taylor, who was our keynote from earlier, thank you for returning and being with us. Andrea Manning, Alexandria Jones, and in a last-minute substitution for Jacqueline Lee, Cindy Latney, who will be taking her spot. So thank you, Cindy, for volunteering for this. We're thrilled to have you all as a part of this conversation and celebration. In a moment, I'm going to hand the microphone over to our panelists so they can do some brief introductions before we get our conversation started. But I also wanted to introduce the moderators for this event. Dr. Heather Goodin, who is our current leader in the School of Nursing, and Hannah Hald. If you could please stand. Hannah is a senior nursing student in the traditional undergraduate program, and she also serves as president of Capital University Student Nurses Association. So thank you both for being here. Last but not least, I already read the disclosures, but just a brief reminder to be sure that you fill out the evaluation form before you leave and put your name at the top so we can get you those certificates. Thank you all again for being here with us as we celebrate this milestone event. And now I'm going to hand the microphone over to our panelists for some introductions. Oh, yeah, that's right. Thank
you. Hi, working? Hi, I'm Andrea Manning. I'm Vice President of Clinical Services at Nationwide Children's Hospital. I graduated from undergrad here at Capital in 1998, which seems like forever ago. Cannot lie, but this place has been amazing for me, and I'm very excited to be here and celebrating 75 years with you all. At Nationwide Children's, I oversee 6 of the inpatient medical units. I also oversee our dialysis, spiritual care, and I also have respiratory therapy as some of the operational areas that I'm over, but then I'm also co-director of our Quality Leadership Academy and a co-lead for our medication safety core team at Nationwide Children's, where we have seen an 85% reduction in medication errors through the time of our work there, and it's just been an amazing journey, leadership journey, and journey of nursing that I'm excited to share as we go on today.
Good afternoon, Marti Taylor. Good to see many of you came back from the luncheon as well. So I am currently the CEO of Ohio Rise with Aetna CVS Health, and it is a program that I mentioned at the luncheon. It was a priority of Governor DeWine's to build out, we believe, one of the only states in the nation that is doing this, but it is a specialty managed care plan to oversee youth that are struggling with complex behavioral health needs. So currently right now there are about 51,000 youth enrolled in Ohio Rise. We work with lots of partners across the state, all of the children's hospitals. We have care management entities that we work with to help coordinate the care for these many youth. So my story is sort of a tale of two states, I would say, between Ohio and North Carolina. I left Capital, graduated in 1986, and left here, I think, because of the Ohio winters. Like, when I think about what's coming next, I was like, oh, I think I'll head down south. But anyway, headed south and had a wonderful start of my career at Duke, and then came back to Ohio in 2011, had a number of great years at Ohio State, then worked for Google, and now I'm working with Aetna CVS Health. And as I mentioned earlier, all of that started right here at Capital, so very grateful.
Hello, everyone. I am Cynthia Latney. I have the honor of serving as a Senior Vice President and Chief Nurse Executive for Ohio Health. I've been here in the community for 4.5 years. My role there really stems over 10,000 nurses that I lead across 53 counties. So Ohio Health is pretty large in that way. I graduated in 1987, got my master's, and I am a candidate for my doctorate, so I'm working on that. And it's really has been just a calling and a pleasure to lead the organization. Nice to be here.
Hey everyone, my name is Alex Jones. It is such a pleasure to be here, and thank you so much for the planning committee for the invitation and to be with the other esteemed panelists today. So I do have a confession to make. I am an imposter. I am not a Capital grad, but I'm a big fan. I'm a huge fan, and I am actually at Franklin County Public Health, which is one of 2 local health departments here in the community. I serve as Assistant Health Commissioner and Director of Prevention and Wellness. So I have the privilege of sitting on one of the Capital University School of Nursing advisory boards. So we know that our patients are only in clinical and healthcare settings for a small amount of time, but 99% of the time they're in their community, and that's where I love and my passion is. I have the privilege of serving in various positions, such as overseeing our infectious disease control and response, maternal child health, and immunizations and school health. So really looking forward to the conversation today.
Hi, my name's Hannah. I just wanted to thank you guys for taking time out of your busy schedule to be here today. It really means a lot, especially to us students. It's really encouraging to see Capital grads or, ties to Capital. So I will be helping to moderate the event with Dr. Goodin here. So we're really excited to see and hear some of the stories and insights you have as nurse leaders, especially as we celebrate the 75th anniversary of the School of Nursing. So I wanted to kind of get started with something like closer to home, because each of you has some type of tie to Capital University. Could you share how your experience here or with us has helped shape your leadership style and prepare you for your career?
Well, I guess I can start since I'm not a graduate, but I can say that graduating with my BSN and master's have really set my leadership up. I first looked at nursing just through the eyes of my mother, who was a nurse for 52 years, seeing the impact that she had on the community. She was in a small rural community. She was in leadership, and she always talked about how the nurses was her kids and family. And so many times that she left us at home just to be at work. And so I think that was the start of my model of what type of leader that I wanted. I knew as I started at the bedside and wanted to go into leadership, it was the mentors that I had that helped me along the way. But I also knew that having not only a baccalaureate degree, but a master's degree was important through their leadership competencies and skills that I needed to advance.
It's on. So as I reflect on Capital, I would say, really gave obviously critical thinking skills. The graduates that we have that come from Capital, that come to Nationwide Children's Hospital are above par, I would say. I might be biased to say that, but I always know that a Capital grad is going to be exceptional at the bedside, as well as working with their team. When I left Capital, as I reflect, I think that one is not only the critical thinking, but agility as well as perseverance. So the coursework is very rigorous, and the professors are fantastic, but they are not going to let things slide, which is, again, great, because when you are out on the unit taking care of patients, you want to have that confidence to care for the patients and the families, as well as be able to communicate with your team in a way that, because as the nurse, you are leading the care for that patient. And I think that we'll be talking about that a little bit later. But I do recall being, there were times in nursing school that I thought that I might not be right to be a nurse, because it was, there were times where you guys might all feel that way as well. And I just encourage you to keep with it and partner with your teachers and your professors, and you'll make it through.
Yeah, I would say ditto to that. And I would also say, and I mentioned this also during the luncheon, but this notion of rooted and open, I think that is so much a part of what many of us probably are, where we have been rooted in this Lutheran tradition or some sort of faith-based, spiritual sort of tradition, but yet very open. And when I think about my days here at Capital, I never felt like I couldn't be inquisitive. I felt like the faculty were always open to whatever silly question I might have. They were willing to sort of take that on. I think also just the exposure of the many different clinical rotations that we have. I was telling some folks earlier, I remember one of my clinical rotations that I despised was psychiatric nursing. And yet, here for the last 8 years, I've been working in mental health, and I know that because I went through that clinical rotation that I didn't like very much, it really helped me. And then I would just say, lastly, I think the way that the Capital faculty, as Andrea was saying a bit too, sort of push you in a way to say you can do this. And there was a time, I think, when I would think like, if you don't make it, like you're not very good as a student. And the folks that, if I don't know what our retention rate was back in the day, but even if it was 85%, that 15% of like, they can't cut it at Capital. But I think now there is this sense of how do we support that 15%? How do we make sure that 15% know that they can make it? They may decide nursing's not their cup of tea, but how do we make sure we have that supportive culture? And I think that is really alive and well here at Capital.
Yeah, I was just going to say ditto. I think all that, absolutely. And I do, from the position and being able to work with some of the leadership here, really see that behind the scenes. And they do care about all of the percent, like those that are maybe having some challenges, because we know that life and what is happening on the day-to-day, that nursing school is one part of you, but there's a lot of other things that are going on in the background. So that's something I really admire about Capital, that they really want to provide that infrastructure and support. Something that, so I'm actually, and I neglected to mention, I'm an Ohio State grad, so just up the street, so I'm not that far, right? But I really appreciate your holistic approach and your view, and I think That really makes all the difference for us as we are taking care of all of our patients, that we are not just seeing clinical skills, that it's not just that IV, it's not just taking that med, that we're really seeing what's going on with them and leading them, and really being that care manager, that care leader on the unit or whatever setting you are in. So that's something I really value with Capital.
Yeah, thank you so much for sharing those reflections. It's really encouraging to hear you guys speak about it. And being a current student, I can definitely agree that the professors are just so wonderful and have stood out. I've gone to Ohio State and I've seen nothing like it in my experience here at Capital. It's really made a difference. For me anyway, and I think for a lot of the students, the relationships we formed. So building on that, I would like to hear more about your personal path to leadership, and when specifically did you feel like you were a leader, and how do you define the difference between leadership and management?
I'll start. A couple of questions in there, yeah. My leadership journey was one of sort of tapped on the shoulder and somebody saw something in me that I didn't see in myself and said, hey, why don't you think about this, or why don't you think about that? And I've certainly mentored folks over the years who at 35 say, I want to be doing this, and at 36, I want to be doing this, and by 45, I need to be doing this. And I'll say, hold on, take the opportunities as they come, and let others help guide that as well. Because for me, that was so much, where somebody saw something in me. I can remember early as a nurse leader, and I was asked to take on the pharmacy department. And I thought, how tough can it be? It's the pharmacy department. And quickly learned, oh, well, wait a minute. There's a little bit I have to learn here about being over the pharmacy department that's a little bit different from nursing. But I think I would say, when did I become a leader? I don't know. My kids would say I'm not still, but I think, so my first year as a new grad, and so thankful that I had a head nurse, as we called them back in the day, who really sort of helped to guide and mentor me, and said, why don't you work night shift? You'll get your feet under you as an intensive care nurse, so work night shift a bit. It's a little bit slower pace. There's not so much activity going on. So I did. Anyway, it was in that first year, I made a really, really significant medication error. And I gave I remember it like it was last night. I gave a patient 10 times the dose of an IV medication that they were to have. And thankfully, the patient did well. But years later, I realized that medication error, where I became very, very vulnerable. I remember having to go to the head nurse the next morning when she came in, and I thought I was headed back to Ohio, and I was not going to have a nursing license anymore, and I'd be fired and have to call my parents and say, I'm coming back home. And indeed, that isn't what happened. She said, you get your butt in there and you work with a pharmacist and figure out how nobody else will ever make that error again. Figure out the root cause of it. Why? Of course, we didn't have Pyxis machines and all those sorts of things that we have today. But I think that, again, years later, it wasn't at the time, years later, I think I realized that as a leader, vulnerability was something that I needed to be able to show. And vulnerability was probably more important than authority in many ways, that you have to be vulnerable. And I don't know all the answers sometimes, and that's okay, but to have that vulnerability. So I don't know when I really became a leader, but I know there are things that shaped me as a leader, and that medication error was one of them. Management and leadership, I do not see them as one versus the other. I think they are very complementary to one another. I've, for the last 10 years or so of my sort of career journey, I talk about Marti's 3 M's: master, mentor, and make a difference. And I think that notion of mastering often comes in management, where you have to learn the operations, and not to micromanage it, but you better understand it if you're going to have to lead it, sort of thing. Mentoring, I think, then is part of that leadership where giving back to others, helping others grow is so much a part of what we all as leaders need to be. And then really finding that passion that says, what is it that is making a difference in this world? I'm at a point now where I say, wow, let's tackle the big problems and really make a big difference in these problems that healthcare is fraught with today. And so I think those are the things that I think management and leadership has to be complementary to one another. I don't ever look at it as one versus the other.
I don't think in the beginning I really wanted to go into leadership. I think after I graduated from a rigorous program and seeing what leaders have to manage as a bedside nurse, it was just like, that's too much. But in my training, it was in a Methodist hospital where I had my sisters that would help the nurses and be our educators. And I knew when I was on this long haul of 10 patients with just primary care, no PCAs, no one to help us, having 10 patients, I asked the sister, I want to go into the intensive care. Like, this is too much. The hallway was too much. And I remember to this day that the sister said, no, you have to do your time. You have to do a couple of years. And I followed Sister Mary for at least 2 months. Every day I would see her and say, I want to go into the ICU. She finally let me in after a couple of months, and I became, it was in cardiovascular, so I was in the ICU, and it was an academic where extraordinary surgeons that did many things, from heart transplants to, it was just amazing. And so I had mentors to help me along the way that tapped me on the shoulder and saw something probably that I didn't see, to be a leader. And so, you have not only your mentors, but you have your colleagues who see things in you and become to help you move along. And back then there were head nurses. So my first, I would say, manager experience is when I think I was 24 years old. And it was in a 40-bed intensive care open heart, which I was scared out of my wits. Like, what is happening? And I think going through that and working with my friends and mentors, I never thought I would be where I am today. Like, every time you go to one leadership job to another, you always have this moments where you're like, I can't do this, I'm scared. But it really is your friends and your mentors that help you along the way. And I would say sitting here as management leader, I truly believe there's some synergy between both of them. But the vision that we have at Ohio Health is that all nurses are leaders. Even at the bedside, you are leading and you're speaking for your patients. You're advocating for your colleagues, and we need their voice for the changes that need to happen. When I look at leadership, it is across different roles and what their accountabilities are and what competencies that they need. But that is my mantra, is what is it for each role that you need to lead? But in my particular role as a leader, I really believe it is about how do I create an environment where my nurses can practice at their highest level, and that they can think about not only just their mind, but their body and their spirit, and how do we do that collectively so they are successful, so we can get quality patient care.
So sorry about that. Yeah, I think I agree that the management leadership has to be complementary, that management gives you a good set of skills to be the leader that you want to be. As was mentioned, leadership, you don't have to have a formal title to be a leader. And then oftentimes, I'm sure we've all encountered it, we've worked with managers that weren't leaders, just being very frank. So there is, I think, a difference there, but if you're doing it right, they are very synergistic and what have you. So I guess for me, I was thinking about this, reflecting, and taking it, I guess, to high school for me. I remember very vividly. I don't know if you guys remember National Honor Society, if you guys had that. So I remember myself and this one other boy in my class, we both decided we wanted to run for president. And he got up there and he did his speech like, oh yeah, you should vote for me because, you know, whatever. And I had this like little prepared speech and everything. And I just remember seeing everybody's faces like, oh, she's taking it serious. Like, this is something. So that's something that stuck out to me, that I had that opportunity in high school. It translated into college. I was very proud to be a part of the Mount Leadership Society. It was an honorary society. It's Together for Good. And that really set me on my path, I think, for where I am in nursing and public health. That it's broader than us. It's bigger than us. It's the mission, right, to be a leader. My journey a little bit, I paid my dues in the hospital system for a couple years. I did that because I know somebody. I didn't have a sister Mary. I think that's really cool though. But you know, you go, you learn your skills, and I think that was a great experience. I knew that that's not what I wanted to ultimately do, but I learned so much during that time. As Andrea mentioned, that critical thinking, that time management, that like, hey, I got this, that type of thing. And it afforded me the opportunity to go back to grad school at the same time. So interestingly, when I graduated with my degree in public health, I actually started at a director of nursing level. So I went from staff nurse to director of nursing. So I had a lot of management to learn. I knew I felt in my core that I had the leadership, but I had a lot of management to learn. And it really was those mentors. For me in public health, there's the nurse mentors, there's the non-nurse mentors. It really is this collaboration there. So I feel very fortunate for having that experience. And you know, something that I think a lot of us do, maybe some of the students here might feel like, oh, that can't be me, that would never be me. The imposter syndrome is real, and that's something that we need to identify and manage, that yes, you can do this, that you have the skills, knowledges, and ability to do so. So just would encourage you that even if you feel like, hey, that's not me, it could be you if that's something that you want to do. So that's a little bit about my journey.
It's hard to follow all of that. I'm not going to lie. So I'm in agreement with the manager versus leadership perspective as well. I do think from a managerial perspective, it's more about the process and the tasks of things, whereas leadership is more of the people work, if you want to put it into very frank, easy terms. And when I was a new leader, I did not recognize how much time the people work took. Because I had all these ideas and dreams about programming and different pieces like that, when in actuality, taking care of the people that work with you is the most important. And ensuring that you have a healthy work environment, psychological safety. I think those are the things that nowadays, as we're thinking about retention of staff, is going to be extremely important as we move forward. And then for my own leadership journey, when I first thought about this question, I thought about the people that tap to say, hey, I see something in you. But as I was reflecting more, I think the first time I felt like I was a leader, so I was a bedside nurse in the hematology oncology unit at Nationwide Children's, and as a new grad, well, actually anybody that goes into that area, you have to become chemotherapy certified after a certain point of time, as well as then bone marrow transplant certified. So it takes about a year until you're fully trained. And I recall having a really sick patient coming up from the ICU that was on a trach vent, that we never accept those patients. They usually go to a different unit. And I threw my hand in the air and said, I want to learn, I'll take this patient. And I had taken care of him for several months, and I remember him being he was sick, and something was different though. And so I had been recommending different things to the providers about things that I knew that would be the next interventions that would be needed, and they just weren't listening to me. And so although like all of my PCAs and everyone that was around me was doing everything that we couldn't get the additional action that we needed. So I did do my chain of command, went up to the attending, or called the attending, because I think it was on a weekend, and they quickly made the adjustments that I had recommended. And it was after that point in time that I'm like, yeah, I got this, So I think to someone's point, as far as all nurses are leaders, that is something that I want to continue to reiterate. And I think there was a question about, like, when should you start teaching leadership? Day one. I think even with delegation to PCAs and other staff, it's a very challenging skill to learn and to recognize that you are the leader of that care team and you are responsible under your license to ensure that they are competent to provide the care that you're delegating, and that you're double checking back with them to make sure they understand what's being delegated, and that if you did delegate, vital signs, that you're checking back in, or you're asking them to come back within 10 minutes or 20 minutes to update you on XYZ. So it is the nurse's responsibility, and that's the contract we sign with society when we decide we want to become a nurse, and we pass the NCLEX and all of those things. So I think that's it.
Thank you. I think you all did a really good job of showing how leadership can emerge from someone who might not think that they want to be a leader. So I really appreciate your insight. But of course, leadership also comes with a lot of challenges and learning and adjusting. So I want to talk about a little bit more how what it looks like in nursing today. So what are some of the biggest challenges facing nursing leaders today, and how would you approach overcoming those challenges while maintaining a strong and supportive team culture?
Okay. That is my wheelhouse, isn't it? I think it is really tough for our nurses. I definitely don't want to lie about that. Just having 10,000 nurses in different areas, we know how each hospital or even ambulatory, our patients are more complex. What we see as far as even the various roles around the nurse, from our workforce, not having enough workforce. I think we've learned a lot coming out of COVID. I think there's been a lot of change. Some of it's good change out of COVID, but it is tough. And one thing that I know my leaders and myself I really think about is that environment what they're working in. How is it that we can reduce the burden of our frontline staff so they can spend time with their patients and connect with their patients? I know if you're out there in the clinical world, there's a lot of things that the nurse is juggling. It's you and the physician that is leading the care, and when you don't have the other resources around, it can be really tough to do that. The other thing that we know today is our technology, the various in technology. We know we have AI that we have to manage today. So how is it that we can help our nurses? One, how do we make sure that we're hearing their voice? And what do they need at the bedside that needs to be changed? And how, as a chief nurse executive, that I can bring their voice to those changes? But in addition to that, what is it that we need to move out of the way for them? But it is very challenging, and it does keep me up at night. I think the last thing I would share in the challenge is just the violence that our nurses are experiencing today. Not only the complexity of our mental health, but I think society is all being struggled in different ways. We are at the center of the most this pivotal, challenging time in someone's life when they're in the hospital. So you see a lot. The nurses experience a lot. So we also have to train our nurses on how do we de-escalate and keep them safe, and at the same time, how do you keep the compassion and the empathy? And I think as nurses, and if I have my student nurses out there, you have to center yourself and think about what is your values, why you're here, and keep doing those reflections every day to feed yourself so you're coming back and knowing that if you see nursing as a calling, to remember that when you're coming in, to keep it going. But we do recognize that our environment is a challenge.
Yeah, I think for us in the public health space, retention recruitment could be a challenge for leadership. We're very fortunate here in Central Ohio. We have some amazing healthcare centers here that are within a stone's throw. So for us, sometimes just it is difficult for us to compete. We at public health, we're working 5 days a week. We have the option to do 3/12s. You're not making as much money. So I really need individuals to lean into some of the caring for the community, seeing this as a career, seeing this as a life, the passion, the mission, what have you. And that can be difficult because, right now, we're not immune from it. What's going on with the economy, we are seeing people having to make some really tough decisions, and that's our staff included. So being mindful of that and how we respond as nursing leaders as well. Also for us, it's a little bit challenging because, in direct care, you can do an intervention and you see a result. For us, we are looking at health outcomes that take tens years to change, and sometimes they don't change. You do the intervention and they're still not improving as you want them to. So that can be a little bit demoralizing for our nurses. So really working with them to show what they're doing and how that matters and how those interventions, what we are all doing for the greater good, I think is a big piece for us there. And then lastly, I think one of our other challenges is in this current environment as it relates to looking at health equity, looking at disparities. There are certain things that are being very polarized right now, but for us, that's something that we are still leaning into as nurses, that we take care of our clients and that we are wanting to make sure that everybody has the opportunity to be as healthy as possible. So how do we do that? What does that look like for each individual person or community or family member that we serve?
I'll add from Nationwide Children's or from a pediatric perspective, I will tag on about the retention being a major challenge. Speaking from the inpatient side, we do have staff that don't want to work weekends, holidays, off shifts. So they are consistently looking for clinic jobs or going over to public health.
We did take a couple.
Yeah,
yes.
She rubbed it in. She rubbed it in earlier. But I think that's the greatest part about nursing. There's so many different things you can do with your degree that is even outside the idea of traditional nursing. And leads me to one of the other pieces, aside from retention, that has been new since COVID. That's been a real challenge, is our supply chain disruptions that we're being seen. Not only things that the quality of the products that we get, the types of products that we get, and in pediatrics, it's usually the first thing that goes. They're like, oh, I'm sorry, we're no longer making that for peds anymore. And you're like, wait, what? How does that work? So at Children's, we did create a role. It's a clinical value analyst role for nursing. So the nurse, we have now 4 nurses that are the intersection between the clinical staff and supply chain and biomed and purchasing to really be able to use evidence-based processes to determine the type of clinical equipment that will come in, as well as have a whole process in place that's really transformed the way that we do things in our organization. And because, again, since COVID, those supply chain disruptions are just so huge, they're not going to change. It's going to be a continuation, I think probably likely forever, and that role will be even more pivotal. So I think there are challenges all over the place when it comes to healthcare and new technology, new things that are coming out, that I think the biggest piece is learning how to be agile, knowing that change is a normal part of life. So when you're like, why do I have to learn this new thing again? Why are things always changing? Because it is. It's healthcare. It's innovation. There's new ways of doing things. And as a bedside nurse, you're going to have to I would just encourage you to know that as a nurse, you are a lifelong learner, and that's another thing I learned at Capitol that I forgot to mention before, but the lifelong learning is an expectation of nursing. And whether it's because of something that is being driven by a change in the hospital or because you yourself recognize a gap in your own practice that you want to improve upon, that is something as a professional nurse, that is something that you need to be taking ownership of and not expecting other people to identify that and give you the pathway. I kind of went off on a tangent, so I apologize for that.
Yeah, I would say ditto to all of this. I would just add, I think one other challenge is we do need to make sure that we continue to advocate to have nurses at every table. And so when healthcare strategy is being set, nurses need to be at the table. When we're talking about healthcare disruption and how healthcare is being disrupted with wearable technologies or a multitude of things, nurses need to be at the table. And so I think we have an obligation, and I think Capital will do much of this too, but is to make sure that we are getting nurses inserted in all of that. Policy decisions, reimbursement. I mean, I'm not a policy wonk, but I might be someday. But why is nursing not a billable service? Why is nursing just built into room and board rates? Right. So that's going to be one of my goals one day, is to fight that one. But anyway, but I do think we have to make sure that we are overcoming the challenge where still too often nurses' voices are not represented, or too late. They come in with some new technology. It's like, well, wait a minute. Was the nurse helping to design that? Was the nurse aware of what we're doing with this? Well, too late, and now we have to reinvent something. So I think we really have that challenge still ahead of us that we need to keep pushing for nurses. Because we, as seen here and as mentioned, nurses are in so many different settings. And even the role, I'm sure, of a school nurse looks very different today than it did 25 years ago. Or the role of the nurse, it just has changed so much. And so we need to keep pushing to have nurses out there in many different roles and advocating to have them around all of the right tables.
I did just want to reemphasize what you were saying about nurses on board. So critical. So for all of our student nurses out here, hopefully you're a part of your local organization, whether it's a specialty, whether it's the Ohio Nurses Association. I know ANA Ohio, really just critical to get involved now. And I think it goes back to seeing this as a lifelong profession. So, because you're right, there are so many policy decisions that are being made. That are local, that are state, that are national, that need our voices. So just really wanted to emphasize that.
And the boards in your communities.
Please.
Right? You can be on your
Yes.
school board. You can be on your sports board. Any board is where we need our nurses.
On our local public health board, one of our board members is a nurse. So I would highly encourage you to look at your local public health. We need your voices. We need your expertise in the room. So.
Thank you. I think that really gives us a sense of the realities that leadership, face day to day, and leadership isn't just about a title. It also is about influence, and especially for the new graduates and also your staff nurses and other people that you work alongside, and how they're stepping into their power. So leadership can be defined as the ability to influence, even without the formal title. So from this perspective, what qualities do you believe are most important for new graduates to develop so they can be a positive influence to others? And looking ahead, how do you see staff nurse leadership evolving over the next decade as these qualities take root in practice? I can repeat it if you need me to. It was a lot.
So when I think about my new grads and the qualities that they need, I think one is using their voice in communication. If anything, if you're an excellent communicator where you can connect with your colleagues, share your voice, and connect with your patients, that can lead you in so many different ways. Also a problem solver, so that critical thinking of how do you look at a problem, how do you collaborate to bring people to the table to discuss that problem. I think that's very important as well. Compassion, right? Compassion for what all that you're doing. Reflection is very important. I can say that's a key in having those qualities as a leader. you have to reflect on your practice. You have to reflect on what you did that day. You have to reflect on how you impacted someone else. And as a leader, I have to reflect every day of what is it that I helped aid my team, or even when I see a new grad, when I go speak to my new nurses, what role model am I setting so they can follow me in those qualities. So it's important that you, those are some of the few things to think about.
Yeah, I would just add to that. I do think this notion of empathy is really important. I think no fault necessarily of anyone's, but I think some of the technology, we get so hung up in the task, I don't know what the numbers are right now, but I think 50% of nurses' time is spent in documentation or something. So I look forward to the day of AI where that goes off of the nurse's plate and the nurse can spend more time being that person, building the relationships, and really bringing back that empathy that so many nurses have. I think the other thing early on in one's career to think about is the role that they play within the team. So, it's just not nursing in a silo, but how do they work with their other colleagues on the team? You mentioned some of that, but working with the physicians and the respiratory therapist and the pharmacist, because I think for too long, it often feels like, well, the nurse is the one who's at the bedside 24/7, so they're just going to pick up whatever is needed. And we really have to early on think about how do we sort of build broadly across that interdisciplinary team. So however we can build those, what I like to call walk in my shoes sort of programs where you get exposure to the other disciplines and you get to see what it is to work in sterile processing and what does it mean to be there. And if you're not getting your, what you need on time, well, maybe you need to understand what's happening in sterile processing and those sorts of things. So I think interdisciplinary team understanding is really an important quality for nurses early on.
So I'll highlight as well, the communication piece is huge. And what I've seen recently in new grads is the prioritization, I want to say prioritization. They lean more towards electronic communication, like through secure chat or something in Epic versus verbal communication. So the verbal communication is so critically important. So becoming comfortable with your SBAR format or whatnot, that whatever methodology you need to use to get your thoughts in a fashion that makes sense for the receiver, to be able to have that communication that is verbal is extremely important. And I think as a skill that has begun to dissipate as we've relied on technology a little bit too much. So I would say that, and then as well as I feel like I reflect a lot today, but Dr. Taliber, her poem, and this morning or this afternoon, I did read that, and the caring piece is so critical. And you do get caught up as a new grad with a specific task, giving the medication, doing this, doing that. But it really is that interaction, that caring interaction with the patients that you're serving, the families that you're serving, even your team, is extremely important. It's how you say something. It's taking 2 minutes to play with a patient while you're giving his medication, or asking how their friends are doing. It is that caring piece that sets you apart from any other profession. So I would say those are the 2 main things that I can think of off the top of my head. Oh, yes.
I would love to add something to this. I'm a nurse educator in Georgia, and as well as her. But I teach them coming right into nursing school. So I teach fundamentals, I teach the skills. I'm an advocate for taking these students to the nursing home. And I think a lot of people are afraid to go to the nursing home. And I tell them they have to get their hands dirty. They have to learn what it's like to care for a patient. And I have so many students that tell me, they all think it's Grey's Anatomy. They all think they're going to make a lot of money. And all of them want to be nurse practitioners. And they all say, oh my God, I might get my hands dirty. I can't do that. And so I take them with nursing assistants and I assign them the first maybe week
with nursing assistants, and I make them run the halls. I make them give baths, I make them do beds, I make them do all the stuff, the grunt work that they need to learn how to do. And what I tell them, well, all of you are all that in a bag of chips, right? Because you are Georgia Southern University graduates, and they're going to expect you to be able to do all this stuff, and you're all going to work the unit, right? Right? You're all going to work the unit. So guess what? That's basically private duty nursing. So what does that mean? You need to know how to use the bed lift. You need to know how to turn the patient. You need to know how to change the patient. You need to know how to do that because you're not going to have a nursing assistant. And in Georgia, they don't have nursing assistants. There's no help because McDonald's pays more than the nursing assistants get. And so it's totally different. But I'm just saying, even in orientation in the hospital, I think the first week they really need to be assigned at the bedside. Boom, let them go run with an aide for a week and see what it's like. And I had one student tell me, "Oh my gosh, I never knew they worked so hard." You know, because they could have 10 or 15 baths they got to do. And they run up and down, they got to get pillows, got to go do this, got to do that. And they need to see and have that caring piece for the other people on their team and not look down at that other team member because maybe they are a nursing assistant. And I always tell them the story of the nursing assistant that went on actually, and he became a doctor, and he's actually a famous doctor, surgeon at Mount Carmel, and he worked as a nursing assistant and worked all his way up, and I knew him through his journey. But fantastic. Yeah, so anyway.
Yeah, I was going to say the same thing, that, not looking down on any member of the team, that we're all there. So really not seeing yourself as above or below or whatnot, that we're all on the same team and that we all have a similar mission and what we're trying to do for our patients. And then one very practical thing that we're very passionate about is around health literacy, making sure that individuals know why you're doing the care, what they need to do for their own health. For us on the health outcome side, we see a lot of things that could have possibly been prevented if there were some slowdown with the health education, with an opportunity to use teach back. Because unfortunately, we do see some pretty poor outcomes and some deaths and things like that. So just wanted to encourage everybody just to get away from just doing tasks to do tasks, but to really make sure that people know why you're doing things and what they need to do as well.
And I'll just tag on again, but I think at any level, you should be looking at everyone around you as your partners, not above or below or whatnot. In my position, and I'm sure everyone else here as well, I do lead a lot of different people, but they are my partners in ensuring whatever we need to do to get the best outcomes for the patient.
I'm so happy that you shared how you should be starting at the bedside, because I really do think that I did work myself up for every role, and I think that did help me as a leader to understand even that I practice in every role and what I need to do for each role that's around the team. So thank you for that.
Yeah, thank you. I definitely see how it's easy for new grads with not a lot of even life experience to just function in a task-based mind. And as being an older student that has a little bit more experience working in healthcare, I think that's definitely been beneficial. But yeah, I know healthcare isn't something you go into for glam, and it's really hard. So I really appreciate you guys sharing that.
I was going to say, my organization is not Grey's Anatomy. I don't know about your guys. we say it's more like Scrubs. that old movie or the old show Scrubs.
I think we're closer to Parks and Rec. I don't know if anybody's seen Parks and Rec. That is really it. So it's hilarious. Like private sector is The Office, we're Parks and Rec. It's just, yeah, it is.
Quickly, just want to ask one more question as we're finishing up, and before we do our Q&A with the audience. So, what do you view as the most important issues or barriers to improving integrated holistic care for all people?
I'll say reimbursement. No, if you think about the payment model that we have currently, if you think about holistic care, it's one thing if I, as an individual, have a holistic care approach, but if we don't have the funding to have social workers or child life or spiritual care or other folks to help ensure the full scope of services are available for these families, it's impossible to be able to meet the full potential of holistic care. And right now, we are a fee-for-service model, where in actuality it'd be better if we could really look at the outcomes-based payment and ensuring the best outcomes for our families. And then I do think that there has been, I don't know that if there's a shift or not, but there are providers that are conventional thinking and don't believe in any additional type of, they're just there to look at what the acute issue is of that patient, and they don't really, I don't want to say I don't care, but it's not their main priority. So having those different interdisciplinary team members is just even more important and extremely valuable to have.
So I'm the one sitting up here on the dark side because I do work for an insurance company now. So yes, I work for Aetna. But totally respect that, and never thought I would be working for an insurance company. But I do think reimbursement is a big part of it, and now I see it, sort of from the other side, but also advocate for it. And I think it is so much of making sure that we are showing the outcomes, to your point of this fee for service and click, 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 get paid for this, this, this. That has to change. It has to be value-based reimbursement that says what is the outcome that we are paying for. And so again, I see that now being on the Aetna side, and I think there is so much more that nurses, in this case, can do to help show that, the value of what nurses add, and there's so much more. So I do think reimbursement is part of it. I think that's where policy comes in, that's where educating nurses on, how do we get paid for things, all of that. I think that is very important. It may not be day one of nursing, but I think nurses do need to understand it. And then the other thing I would just say that I think is a bit of a blocker is just stigma. There still is a lot of stigma when you think about physical health and mental health. And so whether it's certain providers say, no, I'm not going to take the Medicaid population, or I'm not going to see mental health patients. Right? So there is still a lot around stigma that we have to do. I do think maybe one of the silver linings from the pandemic is that the light was shined so brightly on some of these mental health needs that I think now much of that is surfacing, and there is much more work being done in the mental health space. And so I think that's going to help over time, but we do need to continue to push on this issue of stigma.
If I put my executive hat on, sitting with the senior team and understanding definitely the reimbursement side of, yes, we manage the business of how do we create more access for our patients and the community, and we have to afford all that. But if I put my nurse hat on, part of it is our doing and how we create strategies around when you talk about holistic care. I think nurses have a voice in that. As we get educated on that, working with our physician partners, we can bring in some of that. I've worked in different places around the country. It makes me reflect on when I was in Colorado and had a faith-based community center that was led by nurses, and how we cared for our patients, and really holistic, because we didn't have, we had a physician, but we really wanted to keep our patients there in the community. So nurses can lead a lot of that, but we have to get educated when we're talking about holistic care.
Yeah, I feel like this one is, I feel like I could spend a year talking about this piece, but as was mentioned with policy, I'm not sure if everybody's heard of the Health Policy Institute of Ohio. Amazing organization, puts out some really great publications, really looking at that intersection of healthcare, social needs, basic needs, what have you, mental health and behavioral. But Ohio continues to rank toward the bottom. I believe we're about 45 or 45th as it relates to healthcare value. And that basically means we're spending so much money on healthcare, but our outcomes are still so poor. In Ohio, I'll just speak for Franklin County, we have an infant mortality disparity. And it's such a black mark that our black babies die at 3 times the rate of our white babies. So there are things that we need to be looking outside of the clinical space, that we need to make sure that our nurses are involved at that policy level, at the clinical unit, because what you're doing on a day-to-day does make a difference. One of the big things that I think we need to make sure that everybody's doing here is that we are all registered voters and that we have a voice in that way, making sure that you are talking to your policymakers at the local level as well. We do have some nurse and other types of healthcare providers who are currently in our legislature, so I'm sure they would love to hear from you. And even the ones that aren't, there's policy, healthcare, human service hearings, what have you, where there's a lot of people who are coming and saying narratives that are related to nursing and healthcare that don't have our background and our expertise. So I think for us to have that holistic view, we need to really look at what we can do from a civic advocacy point of view, as well as the local perspective as we are in our everyday employment in our community, what have you. So.
Yeah, thank you again for everyone taking the time off and being a part of Capitol's Rooted in Purpose, Connected in Care. It's your wisdom really honor Capitol's mission and the 75 years of excellence that Capitol has. But it also inspires the next generation of nurses to step into their own purpose and leadership. And so it's been really nice talking with you and getting to hear some of your wisdom and insight into your experience as leaders. So now we want to open up the floor for people who have questions. I can bring the mic to you. So does anyone have a question for any of the panel?
If you could go back and give your younger self any advice as a brand new nurse, what would you say?
It's going to be okay, I guess. It's tough. I don't know about anybody else, but as soon as you hit the floor, you're like, oh, wow, did I learn anything? I don't know. And I think it's just because it's so overwhelming, and I am so thankful for our nurse residency programs that our hospitals and our clinical partners have to really have somebody take you under your wing, because that's so much pressure, but it will be okay. So.
I don't as much have a question as I see this as an opportunity. My name's Audrey, class of 1996, and I'm going to speak this for Deb Shields, who received an award today, but she was very instrumental in my education. And one thing about Capitol is that I found it was very focused on holistic care and self-care and resiliency. And I think that was something that I don't hear from other nurses and their schools that they went to. So I have left. I did travel nursing, worked at Riverside, went travel nurse, and now I ended up in Boston. I've been at Boston Medical Center for 24 years. It's exceptional care without exception, and it takes care of everybody. But we've got wonderful councils, and one of the councils is the Integrative Nurses Council. And I see you leaders as being an opportunity to say, I don't know if you've heard of anything like this, but I started with Therapeutic Touch with Deb Shields, and then I continued on with Reiki, and just have always done that kind of thing. And when you learn that stuff, you're not only taking care of yourself, but then you share it with your patients. So I invite you to look into maybe developing integrated nurses councils, because like you said, there's not reimbursement for nurses, but one thing that our hospital has done is made a council that has a fellowship, and the nurses leave they do a couple shifts on their floor, but then one day a week they go and they are, we can put in a consult for a patient to get pet therapy, aromatherapy, Reiki, and the nurses then take 6 months as a fellowship nurse, and they go around and they can do these on those days of the week. So that I just want to promote that, because we are learning that here, and I invite all of you young nurses to continue to take classes like that, because I find that the nurses who do that stuff are also your healthiest, strongest nurses who continue to really put their hands on their patients with compassion. So, and Nurses Week is also an opportunity for all of that stuff for nurses to give that kind of stuff, because I look forward to my Nurses Week every year, not because I'm going to learn about like some clinical thing, but I'm actually going because I'm going to get free massages and somebody's going to tell me about like that kind of stuff. So it's inspiring kind of stuff. You always feel uplifted. So that's my, it's all started 28 years ago with Deb Shields doing therapeutic touch on one of the tables that's probably still in Battelle Hall.
Thank you. Come on, students, this is your time. There's some impressive people up here.
Hi. So, I know we're a different generation. A lot of us have grown up with, cell phones and media and, different forms of just, public things and public forums giving us different messages and advice on, how to do nursing, different theories, tips and tricks. Is there any sort of message that you've seen that's kind of become more popular that doesn't necessarily resonate with you guys, or you guys would say to proceed with caution about?
No, I haven't.
I guess one of the things I might say is I think, social media, it is what it is. You all, it is very different than certainly when I grew up. But I think there is something about making sure that you have a way to verify, because I think there is so much out there that is good, but that is oftentimes offset then with something that is not true or exploited or, so I would say verify is the word that comes to mind for you, that you don't just trust all that you see out there blindly.
Yes, I do. Hi, my name is Monica Gully, and I came out in 1983 out here out of Capitol. And, the main reason why I came here, they had a 95% passage rate on state boards. Now, wherever you go, these schools are popping up overnight. The test is 2 hours. I took 16 hours. It was 16 hours. So you got these nurses popping up everywhere, coming from any and every type of school. So with you guys being higher up in education, where do you see nursing going from here? Because it really worries me how we were educated then as to how they're being educated now. So what are you turning out? And also, to me, this is contributing greatly to the nursing shortage, because the faster you get in, the faster you're going to get out. And then I noticed also, when you get to Momentum magazines, like with state boards, when they talk about people who've been suspended, put on probation, I noticed those numbers are higher too.
I can just speak from the employer side with Ohio Health. One, any nurse at the bedside, I do require a bachelor degree within the 5 years of employment. So as we are open to all nurses that can prove that they can pass the boards, I also have that expectation of that 4-year degree. Because we do have research that shows that better outcome, better engagement when we have that higher level. And so that is an expectation. In addition to that, we do create partnerships with our higher learning. This is one of the partnerships that we have. So we do look at passing rate and the success of an organization or a higher education program of who we're going to partner with. We want to make sure that we have the best talent that we can to take care of our patients.
I did just want to say really quickly, that's something I admire about Ohio Health, about allowing individuals to come in without a baccalaureate, but then supporting them to get that. for us at the local public health level, for us a big piece is making sure we represent the communities we serve. And so wanting to make sure we have that diversity and that really community focus there. So I really appreciate that, because a lot of times we see communities being left out because of some of those requirements. So how can we support that to make sure that they're as successful as possible?
I was going to say, at Nationwide Children's, we have the same requirement. So we do recognize that it could exclude certain communities that then would not help diversify our staff.
Dr. Manning sort of started to hit on this earlier. I'm curious, given we have a pretty wide generational gap here, or range, I should say, not gap. The initial response to the way that we communicate using social media, using online resources, sending electronic messages versus face-to-face, was to respond to the acute for patient privacy, for hospital liability, those sort of things. Now that we're moving forward, knowing that these new graduates come in, that is a part of how they live their lives. It's not something to be judged. It's something now we get to work with and explore. So how do we foster collaboration, working with each other, growing those relationships so that they become leaders, using the tools in the ways that they work? Because I think the first response was also just very judgmental. Like, yes, face-to-face is always going to have a value, that you will need that in some parts. And also, how do we get to use this new part of their lives to grow leaders?
I think that's a great point. The electronic communication, the social media, the aspects of different apps that are used for communication is extremely important, and we do need, as an organization, to adapt and understand what is the best way that the students, or not the students, but new staff coming in, like to be communicated with. My point as far as the verbal communication being so important, it's the secure chat when there's like 20 different back and forths and you can't get the answer that you need and the patient's deteriorating, right? You need to make sure that you have the confidence to be able to have verbal communication, because that's extremely important for the patient themselves. I don't know that I have. I would rely on my teams. I'm not an expert when it comes to social media and the different ways of communication, so I'd be looking at the bedside staff, the people that are doing the work of what kind of technology do you see that would enhance the work that you're doing, and how can we partner together to make that happen?
Yeah, I would also add that's where the nurse's voice comes into play, that they will need to share with us how they want to be communicated. We have 5 generations in our workforce right now, and we do try to do different types of methods and that they resonate with, if it's inside the walls of our hospitals. I think where we continue to learn when it's outside the walls of our hospitals, but we use, Facebook internally. We're doing podcasts. We're starting to use virtual camera reality for them to learn. So we're leaning into our newer workforce. I think when I saw my last number, 60% of our workforce was less than 5 years. And so that's challenging for me, because that knowledge gap of my experienced nurses leaving, and how do I hold on to them, and how do I get my newer nurses up to speed to give confidence to my physicians, because that's what I hear. And so we really didn't talk much about technology and AI, but that virtual care is another model that is out there that we're leaning into, and it is a way that we're finding in one of our hospitals that it's providing support to our newer nurses, that you have an experienced nurse that's in that box that you can call at any point in time to get support when their preceptor is not there. And so that is the future model that across the country that we're leaning in, but right here in Ohio, in Pickerton Hospital, is where we have that virtual smart rooms that we're going to be expanding. And I know my competitor hospitals are doing that as well, but that is the future model. And that is what we need to start to teach, is how does the nurse in a virtual model, how do they interact with their team? Educators, you're going to have to start talking about that, because that's the direction we're going.
We have a question way in the back from a first-year nursing student. I didn't put her on the spot, I promise you. She volunteered.
My name is Kinsey. What is some advice would you give to students? Doesn't matter which grade, like freshman to senior.
So advice to these up-and-coming, soon-to-be nurses.
I would say a couple of things. Be open to where you think you want your career to go. Again, some of you heard me talk at lunch where I thought I was going to be a pediatric nurse. I never have worked in pediatrics my entire career, even though that's where I was when I was here at Capitol working at Nationwide Children's. So be open to what type of nursing role you want to be in. And then I would just say, many of my 1986 colleagues are here. We had fun. So have fun while you're here, because these days go quickly and you will soon be, sort of in the working world for many, many years. So have fun while you're here at Capitol.
Don't be hard on yourself. Give yourself grace. And I would say take the opportunity when you are in your clinicals to go and learn and go look and see what other specialties are doing, roam around, ask experienced nurses, what do they think? I think that's what's going to be the benefit, because when you start to select who's going to be your first career partner, you want a partner that is going to just pour into you and your growth. And so you're going to have to ask the questions of what you need.
Yeah, absolutely. I just want to echo the be open, because I think that's the best thing about nursing, is that there's so many different things you can do. You can start off doing one thing or not doing one thing and be like, okay, I just want to check this out. And that's something that supports. And we need nurses in non-traditional nursing roles as well. So would really encourage you to look at that. I'm a broken record about getting involved early with organizations. I think some of my best opportunities were because I showed up, and I think that's like half the battle. And so I don't know if maybe people might feel like I don't know enough, I shouldn't be here or whatnot. You know plenty, and we want you there. So please don't ever hesitate to show up and just to get involved early on, because I think once you start that now, it will be easier for you to continue throughout your career.
And I would echo the be kind to yourself. Don't overjudge the performance that you have, or think that people are judging you. Everyone else is in the same boat trying to learn as much as they can and are just as scared as you might be. So don't judge yourself too much. And then I had the opportunity to study abroad in Jamaica, which was an amazing opportunity. We did our pediatric and community rotation there. And I would just emphasize, if you have an opportunity to study abroad, do it. It changes your whole perspective on so many different pieces that it's invaluable.
So as we're coming to the end, we got last 5 minutes. I know we got lots of questions. I know, Cora, you're my idol. I know, you'd want the mic. I'm going to go over here. As we just take this last few moments, I just want to assure with our beautiful panel here this afternoon, are there any last words of wisdom? You've given some advice, maybe just one last round down the line, something that you'd like to share with all these wonderful people here today.
I think early in my career, I came across an article and there was a picture and it said, remember why you became a nurse in the first place. I cut that out and it's been in every office that I've ever had, as well as a picture of a friend of mine who had passed away in my freshman year in high school, which is why I became a nurse in the first place, because I wanted to embody the nurses that he had, because it made such a difference, whether it be a nurse that was caring and asked about how he was doing, or someone that was just coming in and doing a task. So remember why you became a nurse in the first place.
I would say network. I think really stay in touch with folks. Don't feel like you have to reinvent the wheel. Learn from from others over time and do that networking throughout your entire career. It is invaluable.
Nursing has been a wonderful profession. It is a wonderful profession. I would say collaborate and get a mentor. Mentors, different mentors. Don't have to be in nursing, but it's going to be important. So mentor.
Yeah, I just probably you've already taken the hardest step in applying and making this decision, and I just want to say thank you. I know it's not an easy path, and there's a lot of sacrifices that we have to do. So just thank you for all that you do and for caring for so many and caring for the community.
Wow, this has been amazing. How about a wonderful round of applause for our panelists? Also would like to acknowledge Hannah Hald. Please stand up. She did an amazing job moderating, asking very thoughtful questions. Of course, to the committee, it's just been a wonderful day. And of course, as we close, I appreciate all your patience. I know you have more questions, but as we wrap up towards the end of this event, we do have a wonderful reception. So the conversations can continue. The dialogue of the burning questions that you have, you can share with your colleagues. But just enjoy the rest of your time here. And thank you for being a friend of Capitol.